Hello and welcome. We are here to talk about flexibility and the importance of keeping yourself mobile. Always want to keep moving. That's the most important thing. Whereas age may be associated with a decline in flexibility, older adults still have the ability to improve flexibility and with general exercise training programs and with flexibility specific training. In general, there is a decline in flexibility with age. Many of us know that. Many people start to experience difficulty with daily tasks. This is often related to a decrease in range of motion or flexibility in various parts of our body, including our shoulders, our hips, our knees, our backs, etc. There are so many benefits to having good mobility, stretching regularly, and maintaining our range of motion. Some of the benefits is keeping good posture, strengthening muscles, and improving spinal mobility, decreasing back pain, and reducing your risk for injury. It helps keep you active throughout your daily tasks, reduces muscle tension, stress, muscle spasms, and soreness. Heather is here to talk about some of the general guidelines about stretching.
In general, there are two different types of stretching, static and dynamic. Static stretching is a low-load, prolonged stretch where you're maintaining a position for about 10 to 30 seconds. Dynamic stretching involves more oscillatory movements to improve the joint range of motion. It should only be done when the muscles are well warmed up. In general, static stretching is considered to be a safer, preferred method to create lasting lengthening of a muscle and the surrounding tissues. A few guidelines that I want to go over in regards to stretching to make sure that you're doing it safely are that you want to definitely warm up before stretching. So you want to make sure that the blood is flowing so that your muscles are prepared for that stretch. Also, you don't want to bounce during exercise or during stretching exercises. This can lead to injury of the muscle and cause joint pain. It's much better to do your stretching in a slow, controlled manner. Also, don't hold your breath during a stretch. You want to make sure that your muscles are getting the oxygenated blood that they need. Without that, there is a risk of building up lactic acid and causing a lot of pain. And lastly, just that stretching should not be painful. It should be done in a slow, gentle manner. Flexibility training will show benefits when it's done regularly with correct form and with correct duration of stretch. So a stretching program should be done at least 2 to 3 times per week. Each stretch should be performed 3 to 5 times with a 10 to 30 second hold. And you should try to do at least 1 to 2 stretches for each body region. Okay, so Lauren and I are going to go over some stretches that you can try to perform on your own. We'll go through a couple of repetitions of each of them today. So we'll start with some seated exercises. First, you want to make sure that you're sitting nice and comfortably in a chair. And we'll begin by placing your palms together in front of your chest. And we're going to reach up nice and high. And then you're going to open your hands up with your palms forward and come on down to the starting position. Good. You want to make sure that your posture is nice and upright. Bring those hands to the front. We're going to do 2 more of these. So reach up high. Feel that good stretch, hold, and then open. Exhale on your way down. Good. And 1 more. Reach up high. And bring it down. This is a great exercise to be able to make sure that you can reach in those upper cabinets in your kitchen.
Then next we are going to do shoulder rolls. This will also help in improving reaching up into cupboards and things like that. So we're going to start in a chair comfortably. Raise your shoulders up towards your ears. We're going to push them back and then down. So you're going to breathe in, back, and then blow out. We'll do a couple more of these. This can help reduce tension, increase range of motion. We'll do one more.
Okay, we'll move into a neck stretch. With any kind of neck stretching, you want to be real cautious to make sure that you're not increasing any kind of pain. It is a more sensitive area of your body, so the holds are usually more like a 5-second hold. So let's start by placing your right hand behind your back, and your left hand is going to go on top of your head, and you're going to gently move your left ear towards your left shoulder. And we'll hold that for 5 seconds. 3, 4, and 5. Now we can switch. Left hand behind your back, right hand on top of your head. If you're unable to reach up that high, you can simply just turn and tilt your ear to your shoulder. So let's hold 1, 2, 3, 4, and 5, and relax.
All right, we're going to move into neck rotation. So similar to the stretching, you're going to hold just for 5 seconds. So we're going to turn to look over our right shoulder and hold. 1, 2, 4, and 5. And then we'll look over our left shoulder. Again, increasing our neck range of motion helps stretch your upper back and your scapular muscles.
We'll do shoulder circles next. This is more of a dynamic stretch, which is okay for us to perform now that we're a little bit more warmed up. You're going to bring your fingertips up to your shoulders, and we're essentially going to be making circles with our elbows. So we're going to do 15 forward and 15 backward. So we'll begin. 1, 2, 3, 4, 5. Make sure your elbows stay up. 10, 12, 13, 14, and 15. And then we'll go backwards, really expanding those lungs, bringing your chest up. 6, 7, 8, 9, 10, 13, 14, and 15.
Good. Now that we got those shoulders warmed up, we're going to stretch them. You're going to bring your left hand up to your right shoulder. Bring your right hand to your left elbow. And you're going to stretch it down that shoulder. When you feel that stretch, you're going to hold it about 10 to 15 seconds. Again, this will help increase range of motion for any reaching you do with your shoulders, your arms. Good, and we'll switch sides. And again, during all these seated exercises, you want to make sure that you've got your feet flat on the floor, knees bent, sitting up nice and tall. And relax.
Good. We'll do a chest stretch next. So check your posture again. Make sure you're sitting nice and upright, feet on the floor. You're going to bring your hands to the back of your head, and you're going to push back with your back and your neck to really expand those lungs. Make sure that you're not holding your breath. We're going to hold and relax. We'll do 2 more of those. Again, it should be pain-free. Nice deep breath. And exhale as you come forward. And one more. And relax.
Next, we're going to do an overhead reach. So you're going to interlace your fingers on your lap. You're going to start with an inhale here. And then exhale as you reach up. We'll start back at center here. Inhale and reach up. We'll do one more. Good.
Very good. We'll move down to our hands next. This is a great exercise to do if you have arthritis, just to kind of get your hands warmed up and ready for the day. So you're going to extend your arms out in front of you, and we're going to be opening and closing the hands. Let's start with them closed, and then open as far as you can. Really stretch those fingers apart, and hold, and bring your hands together. Let's do 5 of these. Open. Feel that good stretch, and close, open, and close. If this is difficult to keep your shoulders that high, you can rest your hands in your lap and do them as well. One more. Open and close.
Good. We're going to do a tricep stretch next. So again, sitting in the chair, you're going to extend your left arm with your palm up, bring it back to pat yourself on the back, and then you're going to reach up with your opposite arm, give it a little bit of a stretch back, gently press, hold 10 to 15 seconds. This stretches your shoulder and tricep muscles, improving the ability of your upper arm and shoulder. And relax. And we'll switch arms. Pressing gently and hold. And 10. Good.
Good. All right, the next one is for our hips. Now, if you've had a recent hip surgery, I would not recommend this, but you're going to place your right ankle on your left knee. You might need to scoot forward a little bit, and you're going to gently push down on your knee until you feel that stretch. We're going to hold this for about 10 to 20 seconds. This exercise is great because it stretches the inner thigh, which will help you for getting in and out of a car or stepping up and over the edge of your tub. A few more seconds here. If you have difficulty getting into this position, I'll show you a modified way when we do the other side. So relax and switch legs, bringing your left ankle to your right knee if you're able. But if you're unable, you can simply cross at the ankles and you can push out and hold. And relax.
All right, and now we're going to do an ankle stretch. So this one, you're going to go out to the edge of a chair, and you want to have an open space underneath so that you can, we'll start with your right foot back. You're going to put your toes back and try and push that heel down and really feel that stretch in your ankle. I recommend chairs with arms on them, give you a little bit of support here. You're going to hold that about 5 more seconds here. And then we'll switch. Mobility in our ankles is very important. any lack of mobility in your ankle can affect your balance and your quality of your walking. And relax.
Ankle circles are next. This is going to really help with any swelling that you might have in your ankles. We're going to start by extending one knee, and you're going to make 10 circles in each direction. So 1, 3, 4, 6, 7, 8, 9, and 10, and then back the other way. 3, 4, 5, 6, 7, 8, 9, and 10. If it's difficult to hold your leg up for that long, you can cross at the knees and perform it that way as well. So we'll do 10 in one direction. This is also good for your coordination, and like Lauren said, really important to maintain the mobility in your ankles for your balance. Eight, 9, and 10. We're going to move into some standing exercises next. So you want to stand with your feet shoulder width apart, nice and tall posture. And you're going to take your hands and interlace your fingers behind your back. And you're going to gently move your arms back. And we're going to hold that for about 10 seconds. Remember, this should be pain-free, so just whatever range is available to you is fine. 7, 8, 9, and 10, and relax. We're going to do 2 more of those. So bring it back and hold. Remember to breathe. 6, 7, 8, 9, and 10. Relax. And one more time, reach back. This is a great exercise for your shoulder flexibility. Very important that you maintain this range of motion so that you can reach back comfortably for armrests before you sit down in a chair. 9 and 10. Relax.
Good. We're going to move into a thigh stretch. So you're going to want to come to a chair and bring your feet apart as far as comfortable. And you're going to bend your knees out to the side. We'll go down just a little bit, pause, and hold 10 to 20 seconds. You want to make sure that you're bringing your knees out. This will improve your hip and your thigh range of motion. It'll increase your functional ability during walking and standing. And we'll do 2 more of those. Down and try and pull those knees out just a little bit. 6, 7, 8, 9, and 10. And 1 more. Again, make sure you're always breathing during these exercises. And up. Good.
All right, we'll move into a back stretch. So you're going to stand nice and tall. Again, your feet should be shoulder width apart. And you're going to place your hands kind of on your hips, your low back area. And you're going to extend your back. So you're kind of arching back, bring your chest forward, and we're going to hold for 10 seconds. Make sure you're not excessively extending your head. It should be a comfortable exercise. And relax. We'll do it again. If your hand position is uncomfortable, you can adjust accordingly. And arch back. Remember to breathe. And relax. And one more time. This is a good exercise so that you can comfortably bend and reach, keeping that back nice and flexible. And relax. Good.
And we'll move into a quadricep stretch. So these are these big muscles up here. And you're going to reach for one of your feet, and you're going to give just a gentle pull towards your buttocks. And you're going to hold it when you feel that stretch, about 10 to 20 seconds. 6, 7, 8, 9, and 10, and we'll switch. These stretches are good for walking and your balance. 9 and 10.
Good. Feeling nice and limber.
Yeah.
We're going to do a calf stretch next. It's also good to use the chair for support during this stretch. You could do it against a wall as well, but today we'll demonstrate with the chair. So let's place your right foot in front of your left, and you're going to kind of lean in towards the chair. You want that left leg to stay nice and straight, and lean in until you feel a gentle stretch. You're going to feel it at the back of your left leg, especially up by the knee. Make sure that your left heel is staying on the ground. I'm just going to hold this for about 10 to 20 seconds. And then gently come up. And we're going to switch legs. So left in front, right in the back. The right leg stays nice and straight as you lean forward. Keep that heel down. This is really important for making sure that you can extend your knees. You want to be able to straighten those all the way. Very important in your walking quality. So we'll hold here a few more seconds. And relax.
All right, we're going to move on to the hamstring stretch. Okay, this is for a hamstring stretch. Stretching your hamstrings and increasing the range of motion will really help when you're trying to get yourself dressed. So you want to pick a firm surface, keep one leg down, and you can reach to your knee, your ankle, your toes, whatever is most comfortable for you. And you're going to want to hold it for about 20 to 30 seconds. Make sure your knee is down and your toes, you want them pointing up. You don't want them pointing down. We're going to hold that stretch another 10 seconds. 6, and then we're going to switch sides. You can pick a couch, a bed, whatever is most comfortable for you. And we're going to reach forward a little bit and get that stretch. When you feel that stretch, you'll hold it. 6, 7, 8.
Thank you for joining us today. We hope that you learned some new things and have some takeaway information to help you start with your own stretching program. If you have any questions about what's most appropriate for you individually, please contact your doctor, or if you have a physical or occupational therapist, they would be able to help you with that. Have a great day.